topic is assessments. Kelly, when's the last time you've done an assessment?
You know what? It's been such a long time since I've done an assessment.
Gosh, me too.
I think I need a refresher.
Well, good thing I've recruited some of the best nursing students University of Akron has ever seen to go over some focus assessments with us.
So what do we do first?
We're going to start with a neurological assessment.
Dude, speaking of neurological, you know what gets on my nerves?
What?
Myelin.
That was a good
Taylor,
one.
to you.
Hi, my name's Taylor. I'm your nurse today. I'm just going to do a neuro assessment. Can you tell me your full name?
Taylor Noel Henry.
Where are you?
In the hospital.
What is the day today?
Tuesday.
And who's the president?
Trump.
All right, go ahead and put your hands out. I'm going to have you squeeze my hands. Pull. Push. Okay. Wiggle your toes. Pull. Push. Okay. Then I'm going to look at your pupils. And just look at me. Okay.
That was really good, Taylor. A good neuro refresher.
Yeah, I always forget to check the pupils, so I'm glad. Yeah,
Me too.
I'm glad
That
I
was
got
good.
to see that, to remember
That's good.
that.
So what do we have next on our list?
Next, we have cardiology. And speaking of cardiology, Kelly, I think you're a cutie.
Don't be tacky. All right, Dustin, you're up.
Hello everyone, this is Dustin. I'm going to talk to you about a cardiac assessment and do a little refresher. So first we're going to want to inspect our patient. We're going to look for any abnormalities such as a jugular vein distension. After doing this, we're going to move on to auscultation. We're going to listen for the appropriate heart sounds such as S1 and S2 along with the heart rate. We also want to listen for any irregular sounds like murmurs, and we want to know anything that is abnormal in our assessment. We also want to add a peripheral exam. We want to feel the patient's pulses, make sure that they are equal bilaterally, and note how strong that they feel. In this assessment, we also want to look for any edema in the patient, irregular skin color, temperature, capillary refill, or anything that is cardiac related in this assessment, and note them as well. Looking at the patient's vital signs, listening to the patient's complaints, history will also aid in this exam. All right, that's it, guys. Back to you.
Thank you, Dustin. That was so great.
It was great. So, hey Kelly, are you a pulmonary embolism?
I don't think so.
Because you make me breathless.
Oh my gosh. Let me guess. Respiratory's next.
You got it. Here's Dylan with respiratory.
Hi, my name is Dylan Hochbein. I'm a senior at the nursing program at the University of Akron. Today I'm going to be showing you how to do a respiratory assessment. This generally classifies as 4 things. The first one is inspection. So what you want to do here is you want to look at your client. Preferably you want them to be sitting up. You want to look at their anterior portion of their chest, looking for any bumps, bruises, anything that really shouldn't be there, skin color, anything like that. You want to look at the both anterior, posterior, and lateral. So he's looking good here. Backside, you want to look at the scapula, shoulders, when he's breathing, how his back is kind of going with his deep breaths in. His sides are looking good. Side goes as well. Okay, the second part of the assessment is the palpation. Palpation. Alright, so what you want to do here is you want to feel, like I said, for any lumps, and the big thing here is let's feel for tenderness. So while you're doing this, ask the patient if they're, experiencing any pain, anything like that. Any pain there? Nope. Okay, then you want to go to the posterior side. Any pain? Nope. Ooh. Lateral as well. Any pain there? No. The third part of the assessment is the percussion. The way you want to do this is you want to take your non-dominant hand, which is my left hand, and you want to go, again, anterior the whole way down all sides, all lobes of the patient, and you want to be listening for resonance. So you use your non-dominant hand and you percuss with your dominant hand. What's resonance? Resonance is the normal sound that a lung filled with air should make. It's kind of like a dull sound, and like I said, it kind of just takes practice to really get that ear and really hear that sound. And he sounds great. Same thing, posterior. And the last part of the assessment, which is a very important part of the assessment, is the auscultation. So the way you want to do this is you want to listen to both lobes on the left side of the lungs, and then on the right lungs, all 3 lobes. This takes some practice. Sometimes you don't really know what they're supposed to sound like, but they are supposed to sound clear, no crackles, nothing like that. It's supposed to feel like fully inhalation of air and exhalation of air. And while you're doing this, you want to instruct the patient to take deep breaths through their mouth, out through their nose, and instructing them not to hyperventilate. Okay, in. In. One more time. Go on the toes to your side. And one more. Okay, lateral as well. One more. Well, that concludes the respiratory assessment of a patient, and I want to say thank you to him. And am I healthy? He is healthy. All right, let's go.
Good job, Dylan.
That was
Thank you
great.
for that.
That was
Thank
great.
you. So the next on our list is we're going to talk about our gastrointestinal with John. And speaking of that, Hannah, after we're done with this, my patient needed a stool sample, and I need to write that down.
Here.
Not that kind of stool!
Oh.
All right, John, you're up.
Hey guys, it's John. I'm going to be doing a general overview, just a little refresher on an abdominal assessment. So the first thing you need to do is inspect, and then you're going to auscultate, then you're going to percuss, and then you're going to lastly palpate. So I'm going to do that on my patient here. So introduce yourself as the nurse and just go over what you're going to be doing to them, what I just told you already. So at any point in the assessment you feel any pain or discomfort, to just let me know. Alright, can you lift up your shirt for me? So first you're going to inspect, make sure the umbilicus is midline, look for any other abnormalities that are pretty obvious. Then you're going to auscultate for bowel sounds in all 4 quadrants. Once you hear one, you can move on to the next, and then if you don't hear any, you need to listen for 5 minutes, and if you don't hear anything still, you need to tell somebody. Then we're going to percuss, listening for tympany. If it's dull, well, then you need to tell somebody about that too. And then lastly, you're going to palpate for any masses. If you feel any pain, discomfort, anything in there on this side. Nothing? Alright, that's it. You can put your shirt back down for me. And that is basically how you do an abdominal assessment. Back to you.
Oh, John, thank you. Thank you for that. That was really great.
That was great, John.
Next system we have is our integumentary system. Who's talking for that?
That's going to be Kaylee.
Kaylee. All
Kaylee's
right.
going to refresh us on that.
Hey, Hannah.
What?
What do transplant nurses hate?
What?
Rejection.
To you, Kaylee.
Hey there, all you cool cats and kittens. It's Kaylee Carol Baskin here to demonstrate how to perform an accurate skin assessment on your patient. You'll begin by assessing the patient's normal skin tone. You want to look for any differences in color between comparable body parts, such as the right and left leg. You want to depress any discolored areas and check for blanching. You also want to check the anterior and posterior side for any redness, which may be an indication of increased pressure or infection, as well as any paleness or flushing. Next, you're going to want to assess the patient's skin temperature. You can do this by using the back of your hand or a thermometer, of course, to check. You want to compare symmetrical body parts for differences in body temperature. Next, we'll assess for edema. You want to determine if it's unilateral or bilateral, and you'll grade by the pitting that is done when you apply pressure for approximately 5 seconds. The grade is based on the indentation that's left thereafter. If it's a 1+, it's mild at 2 millimeters with a quick rebound. If it's 2+, it's moderate, approximately 4 millimeters with a few seconds of rebound. 3+ is severe at 6 millimeters with 10 to 12 seconds rebound. And 4+ is very severe, 8 millimeters with a very deep indentation with 20 seconds or more. You'll also want to assess the patient's skin to see if it's wet or dry, and note any clamming or water droplets on their body. Skin turgor is also very important. Poor skin turgor is an indication of dehydration. However, the elderly, as well as those with connective tissue disorders, will also have poor skin turgor. This is done by pinching the patient's arm or their clavicle. If they have a quick return, it's normal. If it's tense, it's considered abnormal, and you're going to want to further investigate. Finally, we want to inspect the body for skin integrity. We want to ensure that it's intact. We want to note any bruising or lesions, as well as any pressure ulcers or the risk thereof. We want to know any disruptions, such as this scrape right here, and we want to identify it on the body and describe it accurately. And that concludes the assessment on the skin. Back to you.
Thank you for that, Kaylee. That was really great. Our last system that we are going to talk about is our psychological system.
That's a good one.
Yeah, I feel like it gets passed up a lot.
Yeah, it's really important as a nurse to worry about your patients' like mental stability, not just their physical health.
All right, and Eddie is going to be here to talk to us, but to lighten the mood a minute, Hannah, what do you call a duck in a clinic?
A duck in a clinic. I don't know, Kelly, what?
A nurse quacktician.
Thanks, Hannah and Kelly. I'm here in the pseudo-psych department, and we have a woman waiting for her psychiatric evaluation. Not gonna need this. Hi, I'm Eddie. I'll be your nurse today. What's your name and date of birth?
Savannah Maynard, March 18th of 2000.
Where are we right now?
In a house.
What year is it?
2020.
Okay. How are you feeling at the moment?
I feel good.
Have you ever thought about harming yourself or anyone else?
No.
In the past year, have you been hit, kicked, or physically hurt by another person?
No.
Do you have anyone you can rely on for support in times of need?
Yes.
Is there a history of mental illness in your family?
No.
Are you currently employed?
Yes.
Who is your employer?
The Courtyard Marriott.
What is the highest grade you have completed in school?
High school.
Do you have any history of mental illness?
No.
Do you have any spiritual or cultural beliefs or practices we should take into consideration?
No.
How do you cope in tried times?
I like to exercise and hang out with my friends.
Very good. Thank you so much, Savannah, for your time.
You're welcome.
While interviewing the patient, it's important to assess for degree of arousal, and she was awake and oriented ×3, which is what you'd expect. How the patient looks or their appearance, and she was appropriately groomed for the situation. Behavior and motor activity, she seemed very calm and relaxed. Mood and affect, there seemed to be a marginal level of anxiety, but this is likely related to me roping her into a fake evaluation. Her speech pattern was clear and articulate, and her attitude was very cooperative. And with that brief synopsis, back to you. Shout out to our professors, Carrie and Diane. Y'all are the goats.
Thank you, Eddie, and thank you to all of our fellow nursing students who were involved in these videos. I hope this was like a great refresher on how to do your full body assessments, because as we continue our paths to become nurses, like this is one of the most essential things that we're going to be doing every single day.
It's so important to be continuously assessing our patients, knowing their baselines, because that's early identification and like a potential problem that could be addressed early.
And ultimately, it influences our patients' lives and their outcomes and their quality of life, so everything that we do matters.
Yeah, we're all in this together. We have a really important job ahead of us, so good luck to class of 2020 nurses.
All right, and of course, to end this, we have more jokes.
What do you know?
I once heard a joke about amnesia. But
What was it?
I forget how it goes.
Oh, I see what you did there. What's the opposite of you're in? You're out.
Oh! Knock, knock.
Who's there?
Pippa.
Pippa who?
I can't tell you that.
Of course. All right, so you should always be kind to a nurse because they choose your catheter size. Ouch. Bye.